Can you hear me now?
Yes, I can.
Hi.
Love music, love life. You're welcome to Soul Sisters for the 18th of June 2025. Wednesdays from 11 till 11:50. What we do here is examine closely, deeply
Hi.
different conversations on different topics. And we go from health to wellness to finances to general well-being of the sisters because it's about them. But we also have something for the brothers because the women, the sisters, the females are not in the society alone. So we always appreciate the brothers who are there in the background, sometimes sending their messages for clarification, to be better educated and to know how to support the women. Thank you. My name is Oluwaseun. Now today, as usual, as is our fashion, we would have uploaded the flyer to our different social media platforms so that you have an idea of what we will be discussing for the next 50 minutes. And on our WhatsApp status, you would find it there. On Instagram, you'll find it there. So we're currently live on YouTube as well. So that allows you to be a part of the conversation and drop your comment and watch the stream later on. This morning, we are talking about something that is of life and death, literally. And as I think about the topic, I remember how when you go to visit a woman who's just had a baby in the Yoruba culture, maybe she and her family, you would often hear people say "Eku ewu omo," which means, if you translate it literally, it means congratulation or it's a celebration on going through the dangers associated with childbirth because ewu in Yoruba means dangers of childbirth, which means there is the acknowledgement of the dangers that surrounds a woman going into the labor room, in fact, carrying the baby to term, going into the labor room and coming out together with the baby. And so we are shining the light on something that you can call a deeply important issue. In Nigeria, the numbers are not pretty at all because it is said that sub-Saharan Africa and Southern Asia accounts for about 87% of the estimated global maternal deaths in 2023. And Nigeria, according to UNFPA as well as WHO, about 82,000 women die annually from pregnancy-related causes. We contribute about 12% of global maternal death, and we just have 2.6% of the world's population. So we need to talk about this because if you look at the causes and some of these things, they are preventable. And so I think who will help us shed the light on this conversation? And I think I just have to go for a non-governmental organization who drive evidence-based intervention in order to reduce maternal and child mortality in Nigeria and Africa. So to discuss the topic of reducing maternal mortality rate in Nigeria, join me as I welcome a public health specialist at Mom and Me Foundation, and her name is Esther Amos. Good morning. Can you hear me? No, she cannot. Esther, are you there? Nah, not what I want this morning. Hello? Mm. Network strikes again. Don't worry. As usual, we'll try to fix things and then be back with you. You're listening to Soul Sisters on Smooth 98.1. Know that you can be a part of the conversation by sending in your messages or asking your question. And the line to send it to is 0809 444 0981. Are you back with me now?
Yes, yes.
All right, let's hope you stay stable this way. Welcome and thank you for joining me.
Thank you.
Okay, so let's get to the definition now. On the surface, once we hear maternal mortality, it's quite easy to say, yes, it means death associated with childbirth. But as I look closely, I realize that it looks like we have durations. So, what exactly, or how would you define maternal mortality?
All right, thank you for having me. Maternal mortality is the death of a woman during pregnancy, childbirth, or within the 42 days after delivery due to complications related to pregnancy or its management.
Ah, okay. That 42 days was the one that I didn't know about before. Okay, but
Yes.
is there any reason why 42 days or it's just random?
Mostly the complications come after delivery. So within
Mm.
those further 42 days, you could have severe bleeding, you could have different things coming up. And then if it is not handled medically, you find out that we lose a child or we lose the mother.
Ah, okay. All right, thank you for that. And so you've already segued into it. Let's get into the reasons. What are the causes of maternal mortality and why is Nigeria having such a number? And please don't, I know it's easy to say, well, Nigeria is the
Mm.
giant of Africa in terms of population, so it's only expected. No, it doesn't have to be. So please talk
Yeah.
to us about that.
Okay, so the causes of maternal mortality can be either direct or indirect. Direct in the sense that these are what is directly coming in contact with the woman, which can be infections, it can be severe bleeding, especially after the delivery, and you can have high blood pressure, which is eclampsia, preeclampsia that comes with convulsion or seizures, obstructed labor, and some of the indirect causes can be malaria, it could be anemia, and diabetes due to worsened pregnancy and poor access to healthcare.
Wow, that's a lot. In 2025, we're dealing with this. And but I'm
Mm.
curious because I know that you did a number of things in the north, right?
Yeah. Yeah.
From being in primary healthcare. So talk to me about the health seeking behavior over there and from your experience, maybe
Mm.
as a public health specialist or a volunteer, how is it like? What are the factors? What's the education level of what they ought to be doing?
All right. Yeah, what we do in Mom and Me Foundation, basically we fight against maternal mortality. And some of the factors we've identified is, of course, poor access to quality antenatal services, especially in the rural areas. So we find out that women in the rural areas do not have access to these antenatal services, which in turn causes or is a factor that contributes to maternal mortality. Another factor is cultural and religious stigma. Sometimes in some particular parts of the country, you find out that it's not normal for them to talk about their reproductive health. So some cultures actually see it like a taboo to talk about their reproductive health. We also have low health literacy. Many women do not recognize that, oh, there is a warning sign or there is a delay in care, and so they will not even think of seeking care at the particular time they're supposed to seek that care. We also have weak referral systems. Of course, this is one of the major delays we have in the health system, where there are complications, emergency, but the time that it takes to refer those women to a higher medical authority. We also have limited female autonomy, where some women do not have the permission. They have to seek the permission from their husbands for them
Mm.
to actually seek care. So it's a major issue. Even if they want to seek care, they have to ask for permission from their families, from their husbands before they could access care. And of course, yeah, the health system too is another major issue because of underfunding and then shortage of skilled birth attendants too.
Wow. Let's take it one after the other. Let's talk about the
Mm,
primary healthcare. I'm particularly
mm,
interested in that. And I know that some years ago we had the midwife scheme that was done by the federal government. Is that still on? How
yeah.
effective is it?
Well, as we all know, primary healthcare is the first line of contact with the community, and it is where women actually get the early detection, they get the antenatal screenings, the services, and all. And if these systems are not working, definitely there's a problem. Because if the first point of contact I have to make with the medical body is not effective, there would be a problem. And according to National Primary Healthcare Development Agency, about 80% of these primary healthcares in Nigeria are not functional. They are not functional, or they are underfunded, or they do not have skill attendants, medical skill attendants that are trained to accept women. So you see, if there is a problem there, definitely this would contribute to delays. This will contribute to the access to quality healthcare.
So I think at this point, I'm going to turn the topic to reducing maternal mortality for dummies, because I'm going to be asking really basic question that you will think this is apparent. You should know the answer. So let's go back to the primary healthcare centers being functional. What needs to happen for these centers to be functional? Are you with me? Mm.
All right. As I've said, it's the one line of action that I'm with you. Can you hear me?
Yeah, there was a little bit of lag, but you can go on now.
Are you getting me?
Yes.
Hello?
Hello. If you can hear
All
me,
right.
I can
So
hear you.
one of the basic things that um, from the government could do is to provide more funding to primary health care centers.
Mm. Are you back? All right, so we're going to go on a breather. And when we come back, hopefully things are sorted.
Can you hear me now?
Yes, I can. Just a moment. We'll be right back.
And you're listening to Smooth Learning. Don't go anywhere.
How about now? I'm taking a breather so that we can see how to fix things.
Every weekday from 1 p.m.
Can you hear me? Maybe you exit and join again, and let's see if that works. Or maybe you can switch network or join with another device.
Your name is Gloria Azia Young, and you're tuned to Smooth 98.1. Stay tuned.
Uh, are you good now?
Yes.
All right, so let's hope it stays this way then. So when we come back, we continue with that question. I think you were explaining about how the government needs to spend money where it matters.
All right. Thank you.
Thank you for staying with us. You are listening to Soul Sisters on Smooth 98.1. And against all odds, we are going to have this conversation about maternal mortality here in Nigeria and how we can reduce it, because many of the things that cause this mortality rate, they are preventable. And so right now we are addressing the issue of primary healthcare centers, especially in the rural areas, because they can be quite effective in preventing the mortality cases. And we're talking about how they are not functional, they are underfunded, and they lack skilled hands. And so again, I think I've nicknamed it reducing maternal mortality for dummies, because we need to ask the questions as basic as possible, because some things, for the lack of a better word, don't make sense. So why are these primary healthcare centers in the rural areas where people who have lives who need to be taken care of, are carrying babies, why are they not functional? Who do we need to call out? Or what do we need to do? Esther, please go on.
All right. So, like I said, underfunding has led to cycle of poverty. It has led to a lot of things like shortage and low trust in the system, and this affects the women directly as they have to use unskilled birth attendants, which is actually dangerous for them, and it actually leads to the causes of maternal death. So for us to really reduce maternal mortality, we must prioritize what we need to prioritize first, which is health. And then for us to do that, we have to properly invest in the primary health care, which is the first line of contact with the community. And not as an afterthought, it should be a national priority, not just an individual thought. It should be a thing of concern. And then that means funding, staffing, training, and community engagement has to be there for us to actually have this accessible to women.
Mm. All right, thank you. Now, if we move on, I'm trying to hold myself back from pulling out the budget and looking at the numbers that
Mm,
have been allocated to healthcare.
mm.
I'm trying not to turn this into but at the end of the day, we just cannot avoid these things. However, let's just stay here. Now, in terms of the individuals, are there things that individuals can do in order to prevent or maybe reduce this mortality rate?
Yes, we could, as individuals, actually hold people accountable, people that are supposed to repair the systems. We keep on creating awareness and keep on telling people about it, that's educating people about these causes, about these issues, about these problems. And then just like part of what we do at Momami Foundation, we have a subsidiary which is called My Lura app. This app is made in a culturally sensitive way, which is going to adapt to like the languages of women in Nigeria. Is going to have where they could check their follow-ups, they could get health informations about pregnancies, complications, or what they are passing through. So as individuals, we could also develop this means, we could create platforms that could help, because presently over 53 million of women in Nigeria actually have access to mobile phones. And this means that we actually have the tools that we need to fight this. And if we have this, it's not just about replacing doctors, it's not just about holding the government accountable, because it might take a while to do that. But in our own power, what we can do is to do the little things around us. So we can actually extend support to those who are left behind by building apps like this, by creating awareness on platforms, creating content, basically raising awareness about what's happening, and then giving an helping hand to the women.
Thank you. Now, still on the individuals,
Mm.
what are some of the safe practices in pregnancy and maybe after it that can ensure life stays, the life of the mom stays? Because I
Mm.
know that there's a possibility of some things that are done before or during pregnancy or after it that can contribute to complication and then life loss.
Okay. First off, women need to understand that antenatal services are very, very important. Attending antenatal, because that's where you actually understand what complication is, the signs when it comes up, what you need to do. That's like postpartum care after the delivery for you to actually take care of yourself and everything. So if you have the right information, you will do the right thing and you know what to do at the right time. So the access to antenatal services and also postpartum care is very important, because people often just think about, oh, the child, just about the childbirth and everything, forgetting that many women actually suffer complications or die after the delivery. So postpartum care is very important. So we must talk about it enough.
Those complications, what are those complications? What are the things that can predispose to those complications?
We can have poor nutrition um, during pregnancy, and based on the some kind of activities that you engage in, such as taking alcohol, smoking. There are different things that actually causes these complications. And I've mentioned earlier that some of it can be gestational diabetes, which is normal, but you have to keep checking and then there are other things like eclampsia, like obstructed labor, that are called an anemia. So these are the things that you need to keep checking when you're pregnant, and then you have to keep going to the hospital for you to know the state on how to curb it. Yeah.
Now, let's turn to those around the woman who's just given birth. I know that people around want to help. Now, what are those things that people around who want to help can do? And what should they know so that they can truly help and not set her up for whatever?
All right, first they should have access to the right information, because you cannot help someone if you have the wrong information. Because at the end of the day, you won't be helping the person but putting the person into danger. So they have to know the right information for them to help them. And then another thing is in a community in the rural areas, we have the leaders, the stakeholders, the faith-based leaders and all. It is very important for them to have the right information, as they can influence families, communities to do the right thing. So if they have the right information, which is culturally sensitive, they could be able to influence the decisions of families who actually go through that have cultural mindset about these things.
The role of midwife, I know it's very important. And again, I
Yeah.
did mention something about the midwife scheme, but let's talk about how what can we do? We have unofficial midwives, we have people who are just concerned. Do we have proper
Mm.
training programs for midwives? How do we integrate it into the healthcare system such that we can save more lives?
So, traditional birth attendants, who are called the TBAs, are the first point of care for women, especially in the rural areas.
Yeah.
And something bad about this is that they are unskilled. They do not have the medical competency to actually handle these cases. But they are often trusted, and they are very accessible to these women in the rural areas. So, rather than replacing them or taking them out, the thing that should be done is to actually train them. So when you train
Mm.
them on when to recognize complications, when you train them on when to recognize there's an issue, when to refer these women, it would be better, because these women actually trust them. So we can't ignore them. We must have to train them, to support them, to partner with them to bridge the gap in maternal care.
Thank you. In case you're just joining us, you are listening to Soul Sisters right here on Smooth 98.1, where we love music, we love life, and we love the woman. We love our health, and we love that she is doing her part in building the nation and in the society, and she must not lose her life in the process of giving birth to a life. And so we're talking about reducing maternal mortality and some of what we can do. Someone is listening and they're thinking, okay, so what's my role in this? How can I help? What would it be, Esther?
So people should like I said, make sure they get the right information for them to actually help, to create awareness to people who do not understand, especially in the rural areas. For example, I talked about the cultural and religious parts, that some women do not have the autonomy to actually go to seek care. They have to go through their husbands. So going into the communities like this and meeting the faith-based leaders, meeting the head of those communities, and actually giving them the right information for them to influence is something we can do. We can create awareness online. We can even have health talks to women. We could go to where they are, if it means for us to do house to house, because some women do not actually attend antenatal services. They are not even allowed to do that. So when you go through the community through the right way, you can actually help by doing this.
Thank you. And I guess there's something in there for the men as well. They can
Yes,
help. Or is there something you want
yes.
to add?
Yes, yes, please. So often men think that they do not have a take in this. They feel it's a woman thing. It's just the women that have to do this and then they are fine. But no, they have a lot to give in this, especially emotional support. Just as little as taking your wife to the antenatal services, actually understanding what's going on, reading about it, actually being involved in it. Male involvement is very, very important, and it goes a long way. You as a man can do a lot for your wife, for your woman, for your sister.
If you have any question, now will be a great time to ask it because we'll soon be wrapping up this conversation. And the WhatsApp line to ask your question is 0809 444 0981. Again, 0809 444 0981. If you're sending a message to us for the first time, please include your name so that we know who's talking to us. And we've been discussing the issue of reducing maternal mortality right here in Nigeria. The numbers are not good. I think, again, it's important to put this into context. We might say, okay, 86,000 people lose their lives, 1 in 100 birth. It might sound so distant until you have someone, someone, maybe a mom, a sister, a friend, a wife. That's when you will know that these things are not just numbers, they are people, they are lives. And so we all need to, I guess, come together to pass on information. For instance, there are some of those practices, and I think at this point I'm going to ask in your education and sensitization, going to the rural areas and sometimes maybe even in the urban areas, what are some of those dangerous but ignorant practices that can lead to complication and eventually life loss owing to pregnancy?
So one of those practices that people do is take herbs. They take herbs thinking it's actually going to help during this process rather than going to the hospital. Because most of these herbs are very toxic, especially to the baby and the health of the mothers themselves. So some communities actually believe that when they treat things spiritually or when they take herbs, is actually going to help them, not knowing that they're actually killing themselves gradually. So these are one of those things. And then definitely not actually allowing them their wives, that's the husbands allowing their wives to actually go to the hospital because it's a very dangerous thing. You might have a sign of complication, not knowing, and you don't know where to seek or when to ask for help, or not even going to where the help is provided for you. So this is a very big issue.
Are there some signs that once you see them in a woman that has just had a baby, you should know this is danger? Immediately, you should go seek healthcare.
Yes, like excessive bleeding. I mentioned it earlier. You could see a woman convulsing, like having preeclampsia and eclampsia. These are actually great signs for them to seek medical help.
Thank you. On YouTube, Anansin Junior Casso says, enlightening for someone who has not got much of this knowledge. Thanks, guys. Well, you're welcome. And finally, as we wrap this up, in what ways can we help mom and me to further spread the information about reducing maternal mortality? And so far, since when the organization started, how has it been? Officially, it said that the maternal mortality rate reduced between 2000 and 2023. This is according to World Health Organization. But
Yeah.
despite that, people are still dying. So tell me about the progress that has been recorded in the organization and what can be done to increase it.
Okay, like I said earlier, Momami Foundation is an organization, a public organization actually fighting to reduce maternal mortality in Nigeria and especially in the northern states, which the numbers are actually high. So you could join us to create campaigns, to talk about it, join us in health talks because this is what we have been actively doing, collaborating with people, going into communities, going to antenatal, supporting women, and giving them the right education, giving them the right sense of education of what they have to do or what they should know about maternal health, not just the mortality rate, but also about nutrition, what they are going to eat, because what they eat actually affects what they actually bring out. And then about exclusive breastfeeding, talks around all these things. And then One Mommy Foundation have actually been educating the younger generation. We had our Catch Them Young program where we educated the young generation for them to understand the issues around maternal health so they would be able to help too.
Mm. Well, we've called out the government and those who are making policies and have the deep pockets and are meant to be releasing funds towards this. But I think we
Mm,
need to maybe do a little bit of call out to
mm,
the healthcare providers as well, because in times
mm,
past, some have been accused of negligence and
mm.
nonchalance. So, what can you say to this?
Yeah, this is very true. We have to continue to do trainings and retrainings, because when you train and there is an issue, you retrain to understand where the problem is. And by you training, these birth attendants or health workers could understand what they are doing wrongly. And also there should be supervision, supportive supervision in all healthcare centers, if it has to be monthly, if it has to be quarterly, to see what they actually do. And the incompetent ones should actually be addressed to. Yes.
Well, finally, on that one, if you as a person wants to have a baby, what are some signs that you would see when you're seeking health? Maybe you go to a healthcare provider, some signs that if you see them, you know that no, they're not mindful of my life and I need to leave this place.
Yes. The kind of information that they give you, they some health care workers do not actually even understand what you're actually telling them, or they are not even giving you the right information. You're telling someone that, oh, you see this, you're bleeding, you're this, and the person is telling you, oh, just go and find something to do, or just take whatever you can. You should know that that person is not helping you. And also, if you go to a primary health care or medical providers, please, and then you find out that they are actually not hygienic. The way they handle the materials they use for testing, for detection, you should know that there is something wrong there and you need to change, or you need to alert. I think that's one of the things too. We should have a very good reporting system, not just for the health
Mhm.
workers, but as the people too, so that we could report cases that we find very detestable, yes, about healthcare workers.
Well, bright idea. Let's say someone who's tech savvy, someone who has the ability to make apps and all of and uses
Mm,
technology, AI, in such a wonderful way to help humanity. In an
mm,
ideal world, what would be some of those technological innovations that you would say can help to reduce
mm.
maternal mortality?
Yes. So we have the digital health now, the mobile apps and all those things. And one of the things we could do is to provide real-time data, because using analog data or written data have been very not really, you understand, it not really helping, because there can be errors and in transports and different things. So yeah, if you could people who are tech savvies could invest in actually providing real-time data, where the health workers could just directly impute the data to a particular server which everybody could see, you could actually know that, okay, these numbers are actually real time, and they are the numbers that you need. And then we could have apps, just like I said, More Mommy Foundation, we are building a app, My Lura. You can have those kind of apps where you actually have health education tips. You could have where they could talk to, like you just said, AI. You could just drop your questions about maternal health, and then it will be a real time answer. So this kind of apps will actually go a long way in solving maternal mortality.
Thank you. And maybe an app that also instantly alerts, maybe it reads, it's
Mm,
totally, I know that we probably have that, but one that not just reads your vitals as a mom or one who just had a baby, but it's connected to all the, I don't think we have that very much in Nigeria. It's connected to
mm,
all the healthcare providers that can help you, such that when it sees something is going out of hand, it quickly sends a signal to them, including
yes,
location and all of that. I mean,
yes.
we ought to use this. We ought to
Mm,
be doing better and be saving lives. So, in case you're listening and you can do such, we would definitely appreciate it. Humanity will thank
mm.
you, and posterity will be kind to you. Thank you, Esther, for your time this morning.
Thank you so much for having me.
And how do we find Mom and Me on socials, or you on socials, so that we know what to do and how to plug into what you do?
All right. We find Mom and Me Foundation on X, on Instagram, on Facebook at Mom and Me Foundation. Yes.
All right, and in case you're just joining, don't worry, we'll save this stream on YouTube for you. Just search for at Smooth 9020 FM Lagos on YouTube. You can watch it with your family, with someone who's expecting, with someone who's had the baby, and share with people. Let the education go around. Also, those who you think they have the ability to fund primary healthcare centers or train them, please share with them so that we can reduce drastically the maternal mortality rate in Nigeria. It's been good having this conversation. Next week, we'll come back again on Soul Sisters from 11 right here on Smooth 98.1. My name is Oluwaseun Olusegun.
Girls, is it? This is a woman.
Thank you very much.
Thank you so much.
So I'll share this link with you on what's it called now? Instagram, so that in case you
Yeah.
guys want to have cut of it.
Thank you so much.
Bye.